Hi everybody and welcome. Today we're going to discuss my project, which was the use of the Bakri in postpartum hemorrhage. So again, my name's Nicole Geiger. I'm a master's prepared nurse. I am the maternal child health nurse educator at our local community hospital, and I have about 12 years experience in this area. So just a little statistics for you here. Did you know that obstetrical hemorrhage is the leading cause of maternal mortality and morbidity in the United States? And most importantly, it can be prevented. So the project description here, what made me set out for this project was after the initiation of SMI, the Safe Motherhood Initiative, I did a learning needs assessment to determine our staff knowledge. And I found that there was a learning gap noted. Staff reported the lack of knowledge and skills on how to use the Bakri, the 4Ts of hemorrhage, and maternal early warning signs. So this was a big driving force for me after doing this whole SMI project, which was designed by New York State, ACOG, AWAN, to help decrease maternal mortality and morbidity rates within New York State. We rolled out the 3 bundles and we thought all was going well. And then we did a quick, at the completion of everything and after a few months of it being in effect, we went back and did a learning needs assessment. And I realized that there was still some learning that needed to take place here. And specifically, it was focused on using the Bakri and actually inserting it and how to use it and set it up during a hemorrhage, how to recognize the 4Ts and the early warning signs and the patient vital signs. So the purpose of this project that I created, it's an educational program that educated RNs on how to assess patients at risk for hemorrhage, know the 4Ts, and the use of the Bakri in postpartum hemorrhage. Stakeholders are the staff nurses, OBs, patients, organization board members, and I wrote magnet status here. So I think it's very important to point out that our number one stakeholders in any healthcare issue or field is going to be your patients and their families. We want to make sure that, you come into the hospital expecting to have this beautiful, healthy, wonderful delivery and baby, and there are things that can go wrong. So our number one stakeholders are our patients and families. They are what bring our business into our facility. So we want to make sure that we have their best needs in mind. But when you look at the larger picture, it's important to recognize your organizational board members. They are the men and women who may be contributing in monetary means and giving money. They're going to want to represent high quality and safe practice. No one's going to want to help support financially an institution that cannot keep high quality and safety at the forefront. And I did put Magnus on here because remember, this is a prestigious award, and failure to produce such care can result in the loss of this award. So it's important to make note that those are, in fact, your stakeholders, no matter how large or small your project might be. Pardon me, let's move that along. Sorry. So some of you might be asking, what exactly is the Bakri? A Bakri balloon, otherwise known as the Cook balloon, it's a balloon tamponade to stop uterine bleeding. It's an effective treatment for postpartum hemorrhage when your first-line treatments fail. So you can see in picture B here, a balloon is inserted through the vagina, through the cervix, into the uterus, and it is applying pressure inside the uterus to stop the bleeding and hold pressure on all those teeny tiny capillaries inside that were once connected to maybe the placenta. Maybe there's a cut or a gouge that occurred during delivery. Lots of factors, which is why we discuss the causes of the obstetrical hemorrhage. We call these the 4Ts. You have thrombin, tissue, tone, and trauma. I did include this picture because some facilities and some organizations and professional organizations may not list like your ethnicity, anemia, although I would put anemia is listed in there. I would maybe add that to like thrombin, induction. That could be your tone issue. You've got a tired uterus, many different factors here, but it's important and essential that nurses are educated on, those at risk for the hemorrhage. You have your 40 weekers coming in for an induction, and they do 2-day inductions where they've had Pitocin running for 18 to 24 hours. When that baby comes out, regardless of size, which is another factor, the size of the baby, but that's a prolonged amount of Pitocin. So you might find a uterus that is just exhausted and cannot contract back up to its normal state. So anyway, there's many other circumstances and scenarios that can play out here, but it's essential that staff are aware of what those causes are. And this program, this project that we rolled out, broke this down for each nurse. We discussed it at great length, and we did morning and afternoon huddles. Going back here, I had a poster board made of what the Bakri is, where we were able to speak to the poster, and there was the actual setup of the Bakri where staff can come and manually and manipulate and use physically, plugging in and setting up a Bakri and doing it for themselves. Implementation of this project, like I was mentioning before, we used Bloom's taxonomy, and it is reported in our text, and as everyone knows here, that Bloom's taxonomy helps us determine the cognitive, psychomotor, and affective domains of learning. So I made sure that we were able to demonstrate the level at which competencies can lead to expected outcomes. We made measurable, meaningful, and achievable outcomes. So like I said, I had hands-on demonstration. Everyone got to use and set up. There was reading to do. We created a web quest where staff had to log into the website before attending the skills fair and complete the required quest. So they came prepared to the skills fair and ready to discuss the use of the Bakri. So this project was pretty cool for my personal outcomes. My goal was to create an educational program for RNs to improve the management of postpartum hemorrhage with the use of the Bakri in order to improve patient outcomes. My goal was to demonstrate my leadership skills by implementing competencies into hospital policies and maintain a culture of safety and best practice. I think that was my most exciting point when I actually got to witness firsthand changes occurring within the institution, and that's when you're a change agent. It really, that was exciting for me. But also, my other outcome, a personal outcome or goal, was to demonstrate effective communication with the interprofessional team by applying evidence-based research to the educational program to improve staff knowledge and patient outcomes. So the student outcomes for this project and for the use of the Bakri was where all RNs from the maternal child health unit is where we started, is to describe the 4 main causes of obstetrical hemorrhage and to promote early detection of hemorrhage, apply critical thinking skills to differentiate those at risk for hemorrhage to improve patient outcomes, and demonstrate psychomotor skills to properly set up and insert the balloon and to stop bleeding and reduce those maternal mortality and morbidity rates. So one might ask, how does this project support nursing excellence? I can tell you it was vigorous evidence-based research. Everything that I used here was up to date and using with the latest and greatest. I accessed A1 and ACOG and reached out to colleagues within my, reached out to my colleagues within my department and really collaborated and came together, and we came up with improved skills that improve patient outcomes to reduce the overall maternal mortality rates in the United States and in New York State. Really, the goal is New York State here. This is, like I said earlier, this is just a small little piece of the entire obstetrical hemorrhage project. There's a lot more to be done here, but we are just taking off a small little piece. So the implications for culturally diverse society. This education on the proper use of Bakri and knowing your 4 T's and your causes and being able to assess those at risk for hemorrhage is a fertility-sparing treatment, and it's ideal for many different cultures. The Bakri balloon, proper use of this balloon will reduce the need for hysterectomy. It can also reduce the need for blood transfusion. So this is huge when we are looking at addressing cultural needs and having a diverse society. Um, Acting as a leader and a change agent, my communication and collaboration with the interprofessional team needed to be stellar. I needed to be able to have clear communication with the OBs, respiratory. We had integrated respiratory into this because we were also obtaining cord gases when I rolled this project out. And anesthesia, knowing that, the patient's going to need further anesthesia when we are managing the Bakri, the postpartum hemorrhage when inserting the Bakri. Some of these women have just had vaginal deliveries and are may or may not have had any anesthesia on board, and going back in and manual removal of the placenta. Like I said, this is a small little piece of a giant project that's been going on. But to be able to act as a change agent for organizational skills, I was able to bring the education and the use of the Bakri to our annual skills fair. It is now a requirement for all MCH nurses. Recognize a learning gap. I was able to create a learning tool and aid to reduce this gap and created a educational program that met the needs of the staff. I made sure that I aligned nursing education with the organization's mission and vision, and I applied my knowledge and skill set to the highest standards and was able to create changes to policies and procedures. My commitment to lifelong learning, I've set goals and I was able to achieve them. I used evidence-based research and practice to bring forth the most up-to-date data, and I shared my knowledge and research to facilitate others in learning. Expanded this project further with the spirit of inquiry. We found some learning needs that occurred during this project that we're going to move forward on. Something that came out, which I'm excited to start this next adventure and project, but we found that staff needed help learning how to estimate blood loss just by visually knowing and recognizing this amount is starting to make me worrisome. This looks like a lot. I'm gonna, get the ball rolling, escalate the situation. And again, that results to early recognition of blood loss can help us prevent obstetrical hemorrhage. And that completes my presentation. So I thank you all for listening. I like this little tag at the end here. What I learned today doesn't make yesterday wrong. It just makes tomorrow better. Thank you, and I hope you enjoyed my presentation.